Welcome to this lecture on notable carcinogens. Here we will be seeing about the high yield carcinogens. First, let's see about alcohol. The alcohol causes hepatocellular carcinoma, that is well known. In addition to it, it can also result in oral or oropharyngeal squamous cell carcinoma as well as the esophageal squamous cell carcinoma. So you can remember this, like the alcohol first enters to the oral pharynx and then the upper part of the esophagus. So alcohol can result in oropharyngeal squamous cell carcinoma as well as esophageal squamous cell carcinoma. What about the aflatoxins? Aflatoxin is that which is harmful because it is being used by the peanut farmers in China. It causes hepatocellular carcinoma. Aniline dyes. Aniline dyes is a dye which is used in a textile factory. When the workers are exposed to the aniline dyes, it can result in a transitional cell carcinoma of the urinary bladder. We have seen that the other organisms like schistosoma organisms can also cause carcinoma of the bladder, but that is not transitional cell carcinoma. Transitional cell carcinoma is caused by aniline dyes. What about arsenic? Arsenic is a fertilizer which is used in small amounts that can help plants to flourish, but it is toxic to humans. Therefore, those farmers or gardeners who use arsenic, they will be using it with their hands. So, arsenic toxicity can result in arsenic lines or mesh lines, which are horizontal lines. Unlike those shown in the picture, this is an AI generated, but arsenic lines will be horizontal and it will be very obvious. In addition to it, arsenic keratosis, that is resulting in a rash on the soles, can also happen in arsenic poisoning. Asbestos causes restrictive lung disease, ferruginous bodies, pulmonary fibrosis as well as mesothelioma. Let's see what happens for all the development. So what happens when asbestos fibers are inhaled? The long thin asbestos fibers reach the alveoli. Alveolar macrophages try to phagocytose them, but the fibers are too long and they are durable. Therefore, it cannot phagocytose. Still, it will try its level. That is known as frustrated phagocytosis. This leads to release of the many cytokines, reactive oxygen species, and finally fibroblast activation. All these are released by the macrophages. And the final component is, because of fibroblast activation, pulmonary interstitial fibrosis happens. This is how the fibrosis is initiated. So the initiation of fibrosis is because of macrophage. So that part has to be clear because it can be asked in the exams. So when this fibrosis happens, what will it proceed into? It will proceed to lung disease. That is a restrictive lung disease can also happen. Now, secondly, what are ferruginous bodies? I told you that the asbestos gets inhaled and it is long and durable. They are asbestos fibers. Those asbestos fibers which have been inhaled are coated with iron and a protein complex. So this coating is made up of ferritin, hemosiderin, which are deposited on the asbestos core. This gives them the characteristic golden brown beaded dumbbell shaped appearance on microscopy. Now, who forms this coating? Macrophages. Macrophages play a role here too. Macrophages, in an attempt to ingest the asbestos fibers, they will be secreting iron and protein containing material such as ferritin and hemosiderin onto the fibers. So over time, this armor plating, like addition of ferritin, hemosiderin, will result in ferruginous bodies. So the long story short, the when asbestos is inhaled, macrophage cannot digest them, but still it will initiate the fibroblast in an attempt to digest, which will finally result in pulmonary fibrosis and restrictive lung disease. Secondly, in an attempt to digest the asbestos, it will be producing protein and ferritin bodies on the asbestos, resulting in ferruginous bodies. Thirdly, it will give rise to mesothelioma. So what is mesothelioma now? The Pleural or the subdiaphragmatic plaques can be described as soft tissue densities which are seen on X-ray. That density, the pleural and subdiaphragmatic plaque, can develop as a white cancer. If you see in the gross picture, it will be white. That circumferentially envelops the lungs. So now, if the question might be asked, what causes this mesothelioma enveloping the lungs? What are those? What are those that envelops the lung? What are those that is giving rise to the subdiaphragmatic or the pleural plaques? They are the mesothelial cells. That's it. So, to whom is asbestos more, who are at higher risk of asbestosis? Those working in shipyard workers, those working in construction workers, those working in electricians, all these occupations are more exposed to asbestos, finally resulting in asbestosis. Some more additional high yield carcinogens are benzene. Benzene causes leukemias. Ethanol, that is alcohol, causes esophageal squamous cell carcinoma as well as hepatocellular carcinoma. Ionizing radiations as well as leukemias can cause classic radiation-induced malignancies such as carcinoma of the thyroid. 2-naphthylamine, it is an industrial dye. It is now not currently used because it is a carcinogen, but it can cause collecting duct carcinoma as well as urothelial cancers. What about some more high yield carcinogens? Nitrosamines and processed meats. Nitrosamines is present in the smoked or cured meats, and that can result in gastric cancer. Processed meat can result in colorectal cancer. That has a direct association with that. Now, what is radon? Radon is that which is emitted from the ground. So, it can result in lung adenocarcinoma in non-smokers. So, it is the second most common cause of lung cancer after smoking. What about smoking or tobacco? Basically, every cancer can be produced by smoking or tobacco. UV light can result in skin cancer such as melanoma and non-melanoma. Vinyl chloride can cause hepatic angiosarcoma, which will appear as nodular liver lesions. With this, we have come to the end of this carcinogen topic. This is small, but then it's really high yield for exams. I have given you a basic outline. All the best for your exams.